Hi, my name is Dr. Brendan McCarthy. I am the Chief Medical Officer of Protea Medical Center, and we are in Tempe, Arizona. Thanks for tuning in. I had this set up in the office where I can jump in, and the other physicians too. They've all said they're going to come in and do these videos themselves as well. The idea is that when I leave a patient or I have a realization or something happened in clinic that's exceptional that I want to share that I think would help other people, we do that. So this is what this setup is. And I had a moment yesterday and I thought it was important to share. And this is just very personal. My daughter is in art school. She's an art major and a studio art major. And the other day she was showing up to a room to draw. And I thought it was just, for a project. She was home from college. And I said, "You drawing for a project?" She goes, "No, I'm drawing for me. Making art for myself." I thought it was beautiful. My background prior to medicine and everything, I was an apprentice Baroque flute maker for Patrick Olwell, and I studied Baroque flute making, Irish flute making when I was younger, much younger. It's the same thing with Patrick making music. Sometimes he'd make a flute just to make it for himself, not to sell it, just to make it for the joy of it. And playing music is like that too. And I had a day yesterday where I practiced medicine for the joy of it. This is a passionate work we do. And I know many of you see a doctor and they just run you in and out the door. And I had a patient today telling me a story of she was pre-diabetic, her and her husband, for years. And then I had them today for my first visit, and they were diabetic today, and they were upset because they're like, every time we go there and say we have, pre-diabetics, what do we do? We're just gonna wait till you have diabetes and treat you then. That's literally what the strategy was for the physician. And that's just not what medicine is. I'm saying this because I had a day. It was a beautiful day. And the reason why this is, I normally have a pretty packed out day with patients. I don't overly stack myself. I see a patient every 45 minutes. So I'm one of those guys that takes his time. Well, I had less patients, a few people rescheduled. So I had more time than normal. But it's like my daughter doing art for the sake of doing art, or Patrick making a flute because it's the joy of doing his work. I practiced medicine for the love of medicine yesterday. And I loved it. I was able to go into the depth I always want to go in. I could spend a little more time with every patient. And it just reminded me why I do this work. This work is so fulfilling. Being able to sit down with someone and help them understand why they are where they are is the most fulfilling thing to me possible. And giving them ideas and solutions to move them forward is a gift. I wanted to share that because medicine is not in a good place in America or any of the other countries where these podcasts are seen. There's so little passion in it now and love in it. And I want you to know that it still is there. There is still so much love and medicine. There's so many opportunities to do good in medicine. And it doesn't have to be the way it is right now. As a physician, my goal is to be in the room with my patient and execute the best medicine possible and execute the best changes that could be tested and proven, and that the patient's life is better for it. That is me. That is my purpose. On top of that, my goal, another goal we have at this practice, is to do everything we can to help educate patients beyond our grasp, our reach, people in other states and other countries, and talk about how medicine could be practiced. And hopefully, over time, it will create a market for that where people will demand the kind of medicine where the doctor sits down with them and the doctor practices medicine because it's their passion and their love. And when they see the woman and the man in front of them with pre-diabetes, instead of saying, I'm just going to wait till you're broken to fix you, they're going to sit down and say, how can I be of service to this couple right now in this moment? What can I do to help make their lives better? How can I be the best doctor I can be? Because when I ask myself those questions, it allows me the opportunity to become a better version of myself than I ever thought I could be. I've been doing this 20 years. 20 years. I still feel the same love for it now as I did when I first walked in the room seeing my first patient. The same awe, the same wonder. It's just something that struck me. That realization of practicing medicine for the love of it. I hope that helps. Thank you for tuning in.